This is a good one. This is me as a director showing the Hollywood elite how to act out a scene. There's Goofy, Wilma, Mickey, Yogi Bear, Fred Flintstone, Huckleberry Hound. I got into animation. I did 50 years in animation. I had a great career. In 2008, I was diagnosed with a devastating disease. The neurologist puts me through these tests, and he just throws a left hook that drops me right to the ground. Lateral Parkinson's disease on your right side. Then he says, 90% of the people who get it laterally get it on their left side.
Parkinson's disease is probably the most complex movement disorder that we deal with. Part of the brain that creates dopamine is degenerating. And so that abnormal communication in Parkinson's disease leads to a whole host of symptoms. The most common things in Parkinson's disease is a resting tremor, meaning while the hands are just at rest, they're shaking at a slow pace. So is stiffness, rigidity, slowness of movements, and worsening posture, a worsening gait or walking function. It's extremely debilitating. One patient in particular that I was fortunate enough to treat recently is a patient that was a cartoonist. Over time, he started feeling that he couldn't draw, and that's how it presented for him.
I've got a mortgage, kids, bills. What am I going to do? I'm through. I'm done. There's no way out of this. There's no cure. There's no way out. That was my thinking for about 42 seconds. And then there was a moment of clarity. I'm a proud member of a 12-step group that has kept me clean and sober for 24 years. And this was at 8 years of sobriety I was diagnosed. It could have destroyed my life, and I fought the disease with everything I had. I went to the bookstore, I bought a sketchbook, I opened it up, and for the first time in my life, I wrote with my left hand, and I did the first drawing left-handed. Taught myself to draw and write left-handed, and I saved a career. More watercolors.
Initially, patients will have the ability to use supplemental dopamine in the form of medication to try and help alleviate these symptoms. But over time, patients will need to use more and more dopamine to get the same effect, and they'll find themselves having fluctuations when they're on their medication, and that will happen throughout the day, several times per day. This is the time period where a procedure like deep brain stimulation can be extremely helpful. The idea is that we use the brain's natural language, which is electricity. And instead of making the brain talk in a particular way, we're disrupting the brain from talking in an abnormal way.
And so we did a Zoom phone call, and then they said, now we want you to come up and visit us at Stanford.
Typically, patients have it done on both sides of the body, and the total procedure takes somewhere around 2.5 to 3 hours, and they can go home the next day. Then we bring them back for the second stage, which can be anywhere from a few days to maybe a few weeks later. And the second stage is where we take the back end of those wires, which we tucked underneath the scalp, kind of behind the ear, and then we create a path underneath the skin to connect from the top of the head to the chest. And that procedure itself takes about 30 minutes and is an outpatient procedure.
Dr. Bush met me at the doors to the operating room, and he's shaking my hand. He says, now, Tim, are you ready to do this? Are you absolutely sure? Come on, let's get in there. Let's go. I'm ready to go. Let's go. Let's go. You would think I was going to Disneyland or something. I mean, I never stopped to think about anything. I never considered any other hospital. It was always Stanford medicine.
We set him up for deep brain stimulation, and I actually had him awake in the operating room because I knew that his problem was drawing. And we guided the electrode into its final location, turned the stimulation on, and had him start drawing.
I couldn't really see the paper or the pencil because there was a light or something in the way, something was in the way. But I'm drawing away, and then all of a sudden I say out of the clear blue, I go, oh my God, it's Dino the dinosaur. And they all cracked up.
It was very powerful, and it was very moving for all of us in the operating room. The amount of reward that I get comes from seeing how our patients respond. It's the reason I'm here. It's such a powerful therapy, and it's arguably the top 1 or 2 procedures out of everything that we can do in surgery that has an immediate and life-changing impact for something that a patient has been dealing with for decades.
This cover title was given to me by a friend of mine, Shaken Not Broken, because I was shaken but I wasn't broken, I could still do it. And I came up with this, An Artist's Journey Through Hell.
He's doing tremendously well, and he's drawing again. He's actually sent me some of his artwork that he's drawn since, which I've framed and put up in my office.
It takes away the shaking. It takes away the slowness and the stiffness. It's given me my life back. Almost 20 years later, I'm fighting this disease still, and I'm telling you, you can do it. You can fight this. You can beat it. You never, ever, ever, ever give up.